in California, it's about 1 in 5 people who would be considered limited English speaking if they walked into a hospital or a healthcare setting and needed to communicate with someone. But even in parts of America that have been thought to be very homogeneous or very demographically stable, over the past decade, they've seen huge changes, particularly in their Latino populations.
The change in demographics means that we're caring for a very diverse group of children and their families. That's a beautiful thing, and it's also a challenge that our hospital faces to be able to accommodate the language needs of those diverse communities.
MAN offers medical services to very low-income families in the community, and services like different clinics like diabetic, hypertension, women's clinic.
We do have a large number of interpreters working with us here, and I'm extremely grateful for that. I wouldn't be able to do this work otherwise. I think it's getting to be a huge factor in everybody's practice nowadays.
They have interpreters here because the doctors, some of them may speak a little Spanish, but in the medical field it's kind of a delicate issue, not having that great communication between the doctor and the patient. Doctor just addressed the patient.
Dr. Leo. Vargas, nice to meet you.
Un gusto conocerlo.
Tell me how things have been since...
He doesn't speak English.
Okay. How have things been since your last visit?
Desde la última visita, ¿cómo ha estado? What an interpreter does is she or he provides communication and rapport between the patient. Between the patient and the provider, so that they're able to communicate better and understand better what's being said and what the session has to do with.
And are you taking your medication on a regular basis?
¿Está tomando su medicamento regularmente? Yes.
When were you first diagnosed with diabetes?
¿Cuándo le diagnosticaron por primera vez la diabetes? It's very important because the patient needs to understand everything that has to do with his health or her health when it comes to medication, treatment, follow-up appointments, everything. And if they're not able to, it could impact their health, very much so.
It is a big issue of awareness, because do you realize how little may be getting through if you can't really communicate with the patient?
Do you need refills of your medication?
And because a lot of the patients, if they don't understand what's going on, will just be respectful and say yes, nod their head. They may walk out and be like, I have no idea what that doctor just said. You know, I have no idea why I'm supposed to take these medications.
I don't know if it's necessary. In the morning I had 86, that was fasting, and now I have 126.
Oh, you mean your sugars are 126?
¿La azúcar la tiene a 126?
Sí, pero ya comía. Yeah, we like to continue on your medication so that your sugars stay low, okay?
So we really need to be working with families as our ally. And to do that, again, communication is absolutely at the heart of making sure that we understand what barriers a family faces, what they are motivated about, what they're excited about, and being able to sort of share and discuss care goals and come up with a workable plan.
You took no insulin today.
Hoy no se puso nada.
Solo pastillas.
I only took the pills.
Amanece de 150 a 170.
Muy malo.
¿De cuánto? ¿De cuánto me dijo?
Let's take all of your insulin shots.
Another critical issue has been, how easy is it to get an interpreter? So we all agree this is a good idea, but we're all busy.
Sometimes there is reluctance on some of the frontline staff to call an interpreter, because I think they consider their job something that's pretty quick, get the patient in and out, and they're pretty backed up. They usually have long lines, so to wait for an interpreter is difficult.
People talk about cost up front, and it's definitely a valid issue, but I think there are actually a lot of operational issues beyond cost, including, you know, does your staff know how to access them? Do you know how to get them in? How big a priority is it? Are you willing to wait, you know, for an interpreter to show up to be able to talk to the patient? And then partly, you know, again, how important do you think this is?
You know, physicians are busy, they're trying to do the best that they can. So if you have to carry some card with 6 codes to type into a telephone, for instance, to get a telephone interpreter, really it's a big disincentive to use, even when you think you should. Maybe you might be inclined to say, well, let's just see how it goes, and since I'm not consenting you for a surgery, maybe it'd be okay.
The healthcare system has really relied on kind of untrained interpreters and just doing whatever we can to communicate. And I mean whatever we can. I mean, you know, playing charades, speaking English more loudly, repeating yourself over and over again, using the phone book to find ethnic restaurants to see if you could find somebody who said they spoke the language on the other end of the telephone.
I think we're all committed to knowing that it's important to deliver care with a qualified interpreter, and so we've worked to reduce the barriers for accessing interpreted care.
And then there's still a lot of innovative programs on larger institutional sides trying to develop programs around both improving access to interpreter services and using innovative technologies like remote simultaneous medical interpretation or video conferencing medical interpretation to enhance access. Our signage in our hospital is in our major languages, which is English, Spanish, and Chinese. And then we also have a system actually for patients who may not be literate. So for example, when people have to go to x-ray, we just tell them to follow the blue line on the floor, and it takes them all the way to x-ray. Another component of cultural competency.
Interpreter services, can I help you? Vietnamese to Zone 1.
Cambodian. You're coming from one end, right?
Cantonese for BMI. Is it possible that I give it to you over the phone? Interpreter services, can I help you? Spanish to where? 91. So that will be on BMI. Hold on, and I will connect you with the interpreter. Okay? Can you please hold?
Mucho gusto. Mi nombre es María Antonieta. Yo le voy a interpretar. Lo que hablamos es confidencial, nada más es entre la doctora, usted y yo, ¿ok? Yo voy a decir exactamente todo lo que la doctora le va a preguntar y lo que le va a decir la doctora a usted.
So let me just go over your medications again, since I know we made a lot of changes today.
Déjame explicarle otra vez lo de sus medicinas porque hemos hecho muchos cambios hoy.
Sí, está bien.
This is for the medications.
Este es para las medicinas.
Okay, this is for the appointments.
Este es para hacer las citas.
Okay.
And when we walk out together, we'll get the cup for the urine, and I'll have you wait in the hall until I have the results back, and then I'll tell you if you can leave.
Y cuando salimos de aquí, yo voy a ayudarle a conseguir el frasco para la muestra de orina, y usted va a esperar hasta que nosotros lo checamos y le damos los resultados.
¿Me lo puedo hacer cuando venga entre 2 semanas? ¿No hay problema?
Or should I give it when I come back in 2 weeks, or it's not a problem either?
I think you should give it now, and then we can check quickly and see if you have an infection or not, because if you do, then we can give you medication for it.
No, yo creo que debería hacerlo ahora, ¿no?
Vale,
porque podríamos entonces checar si usted tiene infección o no.
Está bien.
Si lo tiene, podríamos recetarle medicinas inmediatamente.
Ok, ya me lo voy a hacer nomás salir de acá.
Okay, so as soon as I leave, I'm going to give you the sample.
Okay, good. Because you're on the prednisone, you're more susceptible to urine infection.
Además, because usted está tomando la medicina de la prednisona, usted está más a riesgo de tener estos casos de infecciones.
Okay, do you understand?
¿Usted ha entendido?
Sí, ya lo entendí.
You sure you understand?
Yeah.
Okay.
¿Está seguro que ha entendido?
Sí, ya lo entendí, sí.
Okay. Okay.
Okay.
Thank you.
Thank you.
Sure.
I think what we'll see is that there are substantial benefits to clinics, hospitals, healthcare centers who openly take on this issue and say, we will provide good care to you, and we will provide it in a language so that you can understand and participate and be involved in your care.
When you have evidence showing that language barriers impact access to care, quality of care, satisfaction with care, comprehension of care, and you also have evidence that shows that interpreters actually can ameliorate these things, I think you're obliged to act.